All right, we're good to go.
You're good to go.
All right, good evening. My name is Dr. Brian George. I work at Reconstructive Orthopedics as one of the hand, wrist, and elbow surgeons. This talk is going to be mainly about hand and wrist arthritis with a little bend towards the COVID-19 era. I know everyone's somewhat concerned about going out, going into doctor's offices, getting treatment, and certainly getting surgery. So I'll just do a little bit of a review. If you have any questions, I'll certainly try to answer them at the end of the talk. So here's what we're going to talk about. In general, what is arthritis? What are the common types of arthritis in the hand and the wrist? And then what can we do to treat these on our own and in the office? So in general, arthritis is a wearing out or degeneration of the cartilage between two bones in a joint. A joint is where two bones meet up and there's motion. Each end of the bones is covered with cartilage. This is the most common joint affected in the body is the knee. That's why I have this drawing, because that's what they make. You can see the white, smooth area on the left is good cartilage. That's what we're born with. This cartilage does not grow. It does not reproduce or replicate. It just slowly wears out. When you look towards the right, you have cracks and crevices and wear. That is cartilage. Underneath that cartilage, you see bone. The end stage of cartilage is bone-on-bone arthritis. It's a literal term of bones rubbing on bones. You see the little osteophytes down here. These are bone spurs that generally form around the joints with arthritis. So how do we know you have arthritis? Well, we usually take an x-ray of the hand or any other joint. This is a normal x-ray of the hand. There's a lot of bones in the hand and the wrist. Where these bones meet up, that is a joint. Here you see a relatively normal joint. What do I mean by normal? You see the ends of the bone are nice and smooth. There's a space between the joints. You don't see any bone spurs. You don't see any narrowing or the bones getting close together. And you don't see any angulation or deformity. This would be a relatively normal looking joint on x-ray. You can see that in the main picture as well. None of these joints look terribly arthritic. When it comes to hand arthritis, and I'll touch on this later, the end joints here and the fingers are the most commonly affected, followed by the base of the thumb. Those are the two main ones I'm going to be approaching and discussing today. So what does a joint that's not quite normal look like? Well, if you remember the last x-ray, the joints were nice and smooth. The bones had good space. If you look at these here, you don't see any space kind of between these bones. You got big bone spurs growing out on the side. Here you see that this bone is starting to wear into this bone. It's no longer nice and smooth. Here's an example over here of just joint space narrowing. The cartilage is getting worn out and you're getting bone-on-bone arthritis. These are things that we look for on x-ray to say that you have at least an x-ray finding of arthritis. This doesn't necessarily mean you have pain, but if you do have pain, that's a good indication of something going on. So, common types of arthritis, and these are general as far as the causes of arthritis. By and large, the most common cause of arthritis is what we call osteoarthritis. It's a wear and tear arthritis, meaning, like I said before, you're born with one layer of cartilage on the end of your bones in every joint, and throughout life, it slowly it wears out. Now, there are some factors that can determine how quickly it wears out. Some of them are genetic. You are born with the cartilage that your parents gave you. But with regards to the hand, if you work in manual labor or heavy gripping or repetitive lifting, those can can hasten the time that the cartilage wears out. There's no known cause really. Again, this is just call it aging, but the wear and tear of normal joints. This is the most common joint type, like I said. The other inflammatory rheumatoid that I'll be talking about is much less common. Symptoms, most people complain of pain, better when they rest the joints. Stiffness, especially morning stiffness in the fingers. That's one of the most common early complaints of finger arthritis. Weakness, which may be related to pain or stiffness, but you just don't have the grip strength you used to have. Sometimes you can drop objects. And you can also start seeing lumps and bumps on the hands and the fingers. The second classification of arthritis is inflammatory arthritis or rheumatoid arthritis. The umbrella term is inflammatory. Rheumatoid is a subclass within that. What that means is it's a systemic problem where your body's own immune system starts attacking the joints. So in osteoarthritis, the wear and tear of the world is beating up the joint. In rheumatoid or inflammatory arthritis, your body is attacking the cartilage from within. Usually multiple joints are involved. It could be any joints in the body. You have more sudden onset. You might be fine on a Saturday and wake up on Sunday morning with a huge red swollen knee, wrist, finger, whatever. Here, instead of the normal lumps and bumps, you start to see deformity. The fingers start turning, they start twisting, they start angulating. You certainly need to see a rheumatologist. Rheumatologists treat inflammatory arthritis. There's a lot of new, what we call disease-modifying agents that can really halt the body's immune system from attacking its joint and really improve the symptoms. As the arthritis develops, certainly that's where the hand surgeons get involved. But for any inflammatory type of arthritis, you need to be closely followed by a rheumatologist. So again, back to the osteoarthritis. Again, this is by and far most common. The most common joint is the end joint of the finger, what we call the DIP joint, stands for distal interphalangeal joint, or DIP joint for short. This picture is a little blurry, but the arrow's pointing to that last joint of the index finger. You can already see some bumps drawn into here on the top of the finger, very indicative of arthritic joint. The second most common is the base of the thumb. Again, down near the wrist where you see this red shaded area. A lot of people describe the pain at the base of the thumb or kind of even around into the wrist joint itself. So with regard, going back to the finger arthritis, again, those lumps and the bumps, they have technical names. The ones on the end joints we call Heberden's nodes, and the ones at the next joint down we call Bouchard's nodes. What they really are those bone spurs you see on those previous x-rays. As the cartilage wears out and osteophytes or bone spurs are made, there's not a lot of fat to cover them up in the fingers, so they start to stick out. A little more common in women, but you can see them in men and women. Same thing happens to this down here we call the CMC joint or the basal joint of the thumb. As you get bone spurs down here, you can see a lump at the base of the thumb. Here's a pretty advanced picture, but a picture of fingers with both the Heberden's and Bouchard's nodes, the thickening around the joints and kind of normal caliber of the rest of the finger. Again, these may or may not be symptomatic or painful, but it is a finding of hand and finger arthritis. Thumb arthritis, again, the second most common. The problem is the wear of the cartilage way at the base of the thumb. This is where we get most of our thumb motion from, this joint. And because there's a little less stability to provide that motion, the cartilage wears out. The thumb metacarpal bone tends to slide out of place a little bit, causing uneven wear of the cartilage. Again, symptoms are pain. Significantly with pain with gripping or pinching. I have a lot of patients say, you know, they're dropping their coffee cups or mugs. They go to grip something, they just don't have the grip, or they get a sharp pain and have to drop something. I showed you x-rays previously of arthritis at the tip of the fingers, and here's a picture of arthritis at the base of the thumb. Again, not that you know what you're looking at, but here you see the loss of cartilage at this thumb basal joint. This thumb metacarpal is sliding out of joint a little bit, and you see this cloudy stuff, which is all bone spurs or osteophytes forming around that joint. Typical complaints, again, are pain at the base of the thumb or the wrist, weakness, as I said. A lot of people say they can't open jars or bottles or, even staple paper together. Here's a quick video I just put in that may describe it a little better than I can. No, maybe not. All right, we're having a little, all right, here we go. So again, underneath there's the joint. It gets a little enlarged. You get the bone spurs. You get the bone irritation, and you get pain. So treatment, and I kind of lump these together because in general, treatment for arthritis kind of spans the course of orthopedic, the whole trade of orthopedics, and not necessarily related to hand. So anti-inflammatories are a mainstay of orthopedic treatment for osteoarthritis and even inflammatory arthritis to a certain extent. Anti-inflammatories fall into several categories. We have the oral, the pills. OTC stands for over-the-counter, stuff you can get at the drugstore, and then prescription. I get a lot of questions about herbal anti-inflammatories and a newer form of topical anti-inflammatories. Then we'll briefly discuss heat and cold, compression gloves and splints and supports, therapy to see a physical or hand therapist, injections, and of course the dreaded surgery. So anti-inflammatories. Over-the-counter drugs. So ibuprofen is the generic name you hear. I'm sure you've heard of Motrin and Advil. These are good for short-term pain relief. They usually last 4 to 6 hours. It's difficult to take them around the clock because you have to take them 4 times a day, which is very difficult, but they do work quite well for painful, swollen joints that are caused from arthritis, especially overuse. Naproxen or Aleve is another one. I'm sure you've seen it. It's a little blue pill. It lasts a little bit longer. It's dosed twice a day and can last 12 hours. Naproxen is an excellent medication. I find that patients describe a little bit more stomach upset with naproxen than they do ibuprofen, and that's a main cause for stopping that medication. After you get the over-the-counters, then we go into the prescription medications. 2 of the common ones that I prescribe, this is certainly not an exhaustive list, is Celebrex or Mobic, or the generic names of celecoxib or meloxicam. These are 24-hour medications. The benefit of this is that you take it once a day. It stays in your system 24 hours a day. If you take it every day, then it stays in your bloodstream 24/7. And the theory being that this medication in your bloodstream for several weeks slowly works on the joint inflammation and irritation, and you can somewhat decrease the pain over several weeks. This is not something that will cure the pain in a day. With all anti-inflammatories, you have to take significant caution if you have any amount of kidney disease or diabetes. All of these anti-inflammatory medications get filtered through the kidney, and they somewhat decrease the blood flow to the kidney. So if your kidney is not healthy at all, then I wouldn't recommend these medications, and we'll have to find something else. So how are anti-inflammatories in the COVID-19 era? Well, early on, there was a concern and somewhat of a scare that anti-inflammatory medications were making the symptoms and complications of a coronavirus infection worse. Pretty recent studies show that this does not seem to be the case. Again, the length of these studies are several months, so they're not really conclusive, but we're showing that anti-inflammatories do not really increase the complications of coronavirus. With that being said, if you're concerned, you just take them as you need it. There's certainly no evidence that taking anti-inflammatories would cause you to be predisposed to contract coronavirus infection. And if you had any at all symptoms of coronavirus, cough, fevers, then I would recommend just stopping them altogether just to be safe. Herbal anti-inflammatories. There's two big ones I get asked about all the time. Number one is probably turmeric, however you say it, and curcumin, which is the active ingredient. This is a naturally occurring root. It generally is sold as a powder or even a spice, or it's compacted into capsules. They also sell it in ointments. In general, the research I've read on this, it is safe for kidneys and diabetes. I actually read one study where it lowered the hemoglobin A1C in type 2 diabetics compared with a control group that were not taking this. It does not interfere with the immune system, meaning it won't lower immune response to make you more susceptible to the coronavirus. So I think in general, these are safe to take. Their effectiveness, again, there are studies that show they can decrease inflammation. I read a report in a study in mice where it did slow the inflammation in arthritic joints. Again, that they're not exactly equivocal to human studies, but again, on these herbal medications, the science is sparse. So to sum it up, I think it's safe. It may work. If you're willing to spend the money, I think it's worth a try. These are things you can get in any health food store or pharmacy, or certainly online. The other big one I get asked about is glucosamine and chondroitin sulfate. Osteobiflex is one I put up there. This is the picture. This is the one that's been studied several times. Again, safe in COVID-19. There is some evidence that it does relieve pain from arthritis. They can get pricey depending on which brand you buy, if you're taking it every month. The reason these were initially sold is glucosamine and chondroitin sulfate are sort of the building blocks of articular cartilage, which wears out in arthritis. I don't want you to get the misconception that this will regrow your cartilage and cure arthritis. It will certainly not do that. The studies do show that it can decrease pain, similar to anti-inflammatories, but it certainly will not regrow your cartilage. But overall, it is safe to take if you're willing to spend the money. The only other word of caution is these herbal anti-inflammatories are not controlled by the FDA or any other regulatory body. So whatever's in the bottle is up to the manufacturer and is not really regulated. So just take that with a grain of salt. The next is topical. This is the Voltaren gel is one of the main brand names. Diclofenac is the generic anti-inflammatory that's in there. This is now over the counter. I was just recently in Walgreens and Costco, and tubes of the original prescription strength are available. So this is great. Although it's the same medication as prescription strength anti-inflammatories, there's minimal systemic absorption, meaning you rub it into your hand or your fingers, not a lot of it gets into your bloodstream. One study that showed a similar type of medication in a patch form showed 98% of the medication stayed locally where the patch was placed and 2% got into your bloodstream. So certainly safer for the kidneys if you were worried about that. Again, this isn't a miracle drug, as I tell my patients. If you use this every day, it can slowly decrease the pain and give you, slowly decrease the inflammation and give you some pain relief if used over several weeks. So, heater ice. Again, a lot of people, when their joints are hurting, use heat, use ice. I get asked the question all the time, which one do I use? How do I know? So hot and cold therapy. Heat generally dilates the blood vessels, increasing the blood flow, let's say to the fingers or the hand. Some of the joint stiffness of the tissues around the joints tend to also loosen up and become more pliable. Your finger stiffness in the morning tends to loosen up if you heat it up a little bit. The thoughts are that the increased blood flow increases joint fluid production. Joint fluid acts as a lubricant. Everything gets a little more lubricated. So I usually say use this in the morning or when your hands are stiff and tight. If you were working out in the yard all day and your hand is really swollen and inflamed, the heat can actually aggravate that by bringing in more blood flow and more inflammation. So just a word of caution. It's best to be used with warm up and stiffness. If you go to a therapist, they usually start with heating up whatever joint they're working on, doing their therapy, and then cooling it down at the end of the session. So types of heat. Again, in the coronavirus era, you want to try to do stuff at home and not go to the doctor's office, not go outside. So I just threw in some stuff. So warm shower, warm water bath, hot tub. Could be a bathtub or a hot tub if you have one. Just the warm water running over your hand or wrist can get some of that warmth in there, increase blood flow, loosen up the joints. If you have a hot tub, good for you. Give it a try. Heating pads. These come in all shapes and sizes. They come in the old plug-in ones. Just be cautious that it doesn't get too hot. You can burn your hand, especially if you have any nerve problems, diabetic neuropathy, carpal tunnel syndrome. If you don't have full sensation, just be careful you're not going too hot. They make specialized ones. These pictures are all from Amazon, not to plug them, but they make specialized one. You heat it up, you either stick it in the microwave, you stick your hands in there, and it'll localize the warmth to your hands and fingers. Paraffin baths, again, they sell these online anywhere from $30 to well over $100. It basically coats your hand in warm paraffin wax. It really kind of gets the warm wax into every crack and crevice and gets that deep heat. Patients I know love this. Therapists use it all the time, but they do sell these for home use. I just looked up something to make a heating pad at home. All you need is a sock or an old pillowcase, some uncooked rice, and a microwave. You pack a little sock with some rice, you sew it up or tie it up, and you stick it in the microwave anywhere from 20 seconds to a minute, depending on how much rice you have. You heat it up, you wrap it around your hand. A minute later, it's a little warmed up. I think this is something simple that you can start with at home. So cold. What's cold therapy good for? Well, cold generally tends to restrict or constrict blood vessels, take away blood flow. It also, in doing so, takes away the inflammation. Again, if you use your hand all day and it's swollen and painful, that's when you want to ice it down. Again, you could grab a simple bag of peas or a bag of ice out of your freezer. Again, online, they sell these things that you keep in the freezer and you can wrap around your wrist or put in your hand. Best for pain and swelling after use or activity. So next is splints and supports for hand and thumb arthritis. So starting with thumb arthritis, there's two general types of supports that I prescribe or recommend. The first that you can see in the top right, this is a hard thumb splint. This shows a picture of a custom-made one, usually sent to a certified hand therapist where they can custom make this orthoplastic splint. This splint works to immobilize the arthritic joint and painful joint. You can see that the wrist is out, the tip of the thumb joint is out, and all the fingers are also left out. So although it does immobilize the painful joint, it gives you as much function as you can. So I feel that the immobilizing or hard splints are best for pain relief when your pain is bad. Again, it does provide no motion, so I generally recommend you wear these at night when you don't need the use of your hand. Let the wrist or thumb calm down at night, so that it's better for you to use in the morning. The picture just below this, the black one, is although it looks similar, it's made of a neoprene type material. It's a soft thumb support. It does allow motion. That extra little wraparound band around the base of the thumb wraps around that arthritic joint and gives it a little extra stability. So it helps to stabilize the joint, but it does allow motion. As you know, opposable thumbs are what separates us from other animals, and it's very important in our day-to-day use. So I feel that this gives you the use of your thumb, but gives you a little extra pain control and stability. So I usually recommend everybody get one of these and wear it with activities, especially if it's going to be a highly repetitive gripping or pinching activity. Finger arthritis, a little bit different. Hard hand and finger splints are rarely recommended or prescribed. As you know, if you have finger arthritis, you wake up with really stiff fingers that take a while to warm up. If you further hold them still in a splint and immobilize them, although your pain will temporarily get better, the stiffness will get even worse, and then you're fighting an uphill battle. What I usually recommend is soft compression gloves. Here are two pictures. Now, both of these pictures have the fingertips cut out. They do make versions where the fingertips are enclosed. But what this does is it kind of squeezes out the inflammation or fluid collection, or what we call edema, that tends to collect, especially overnight. It does allow motion, so you can wear these low profile ones during the day. And I typically tell you to wear these to bed at night. As you use the joints throughout the day, they get kind of inflamed, and you go to sleep at night, and they kind of draw in fluid into your fingers, so your fingers and hand are a little more swollen in the morning. This kind of prevents that and kind of gives you a better starting point in the morning. So hand therapy for arthritis. I get a lot of questions from patients. I can just do exercises at home. Do I really need to see a hand therapist? I generally send you to see a certified hand therapist as opposed to a general physical therapist, unless that physical therapist specializes in hands. Hand therapists specialize in treatment of the hand and wrist, as well as the elbow. Specifically for thumb arthritis, I recommend everybody try hand therapy before they try more invasive treatments. Studies have shown that after 2 to 3 weeks of a certain protocol for thumb arthritis, your function and symptoms, including pain, are significantly better. Most of my patients that go through hand therapy for these arthritic conditions are very pleased that they did it, even if they were somewhat skeptical to begin with. Again, I know everyone wants to limit their time outside, time interacting with other people. Hand therapy offices are open. Just like our orthopedic office, they do offer televisits over the phone and over video, so they can walk you through some exercises. They are distancing. You can see in these two pictures, it's one-on-one. These are not wearing masks. But a lot of offices are wearing masks. It's one-on-one. They sterilize every equipment in between patients, so it's generally considered safe. If everything else fails, I do recommend it at least for several visits because it is beneficial. After everything else has failed, topical medications, gloves, supports, splints, therapy, we generally ramp it up in invasiveness to cortisone injections. Cortisone is a generic term for a group of anti-inflammatory steroids called glucocorticoids. They mimic an anti-inflammatory steroid produced by the body. They may lower the immune system temporarily. In general, they are much safer than oral steroids. Oral steroids, to have effect on your hand or wrist joints, you have to take them by mouth. They go in high concentrations in your bloodstream in hopes that some of that gets to your involved joint. Injected steroids, much lower dose, delivered directly into the joint involved. However, some of it does get into your bloodstream and may temporarily lower your immune system. So in general, I think they're safe. However, if you are at higher risk, you have other risk factors that make you susceptible to the COVID-19 infection, I try to avoid cortisone injections. And I certainly certainly avoid oral cortisone or steroids as well. However, if you're younger and not higher risk, you don't have COPD or diabetes or other illnesses, I think they're certainly worth a try. They're generally considered safe, although there are no studies that are done within the coronavirus pandemic. It just all hit too fast, and it's just too little of a population to study. But if you're not in that high risk category, I think it's a good, safe alternative. So thumb arthritis, it's a very common injection to give. Here you see a drawn out spot where we try to stick the needle. It is a somewhat uncomfortable injection. The relief is temporary. Every cortisone injection is designed to be temporary. The typical patient response is 3 to 4 months. Some advanced cases, I get a month to 6 weeks. Some early cases, I've had patients get over a year of relief. Again, it's when all else fails, it can buy you time. If you're scared of certainly this would be, if you're scared of surgery, this would certainly be an alternative that may be safer. Again, usually when everything else has failed. Same with fingers. The thumb joint is a small joint, but the finger joints are even smaller. You can only get a really tiny volume of that cortisone into the joint itself. So they are still effective. However, the pain relief and the length of pain relief after a cortisone joint in one of the finger joints is much more variable. Again, it's such a small joint. It's hard to get a lot of cortisone in there. But again, it's worth trying to avoid surgery. And then there's surgery. When all else fails and you still have pain, and not just pain that limits you from doing heavy yard work, but pain where you can't pull up your pants, you can't cook or prepare a meal, you can't get through life. That's when we consider surgery. So is surgery during the COVID pandemic safe? Well, as you know or may not know, we recently started outpatient surgeries, elective surgeries, as of this past Tuesday, yesterday, the 26th of May. Our current protocol is that all patients get preoperative COVID-19 testing before the surgery, usually about 3 days before, so it gives us time to get the results, and then you are under strict quarantine before you show up at surgery. All staff members, including myself, we all get tested as far as our daily temperatures. We screen for any symptoms or signs of infection, and we all follow the proper protocol of sterilization of our hands and equipment and rooms, and we all wear masks. Anesthesia is a big concern for patients, and understandably so. Pretty much all of my hand surgery involves either a whole arm nerve block. You get an injection up by your shoulder, if you can see me on the screen. This is done by the anesthesia team under ultrasound guidance so they can see exactly where the nerve is. They inject local numbing medication, which provides complete arm numbness for anywhere from 12 to 24 hours. With that, you don't experience any pain during surgery, so you just need some twilight anesthesia or conscious sedation, which you may have experienced for a colonoscopy. For more finger procedures, we do just a local finger block. I completely numb up the finger. You don't feel anything. And again, you could use conscious or twilight sedation. In some instances, we do no anesthesia at all. If you're completely numb and you're okay with laying still on a table for the length of the surgery, then we can avoid anesthesia altogether. Again, no intubation. That's where they stick a tube down your throat. That's where your lungs could be stressed, and you just don't want to do that if you can avoid it, as the coronavirus typically affects the lungs and your breathing capacity. This quick, light anesthesia is quicker recovery, quicker discharge home. We want to get you out of our facility as quick as is safe to you, because we know you don't want to be there around any other people or other patients We also significantly socially distance patients. Most of our patients are in an isolation room before and after surgery, and they only see me and the nurse and anesthesiologist beforehand. So with that being said, what do we do? So thumb arthritis. Here's a picture of a degenerative, CMC stands for carpometacarpal joint. It's rough, it's worn out, it's painful. We've tried everything. What do we do? Well, we typically remove this arthritic bone. We take this out, and then we stabilize this bone, or the technique I use is stabilize this bone with a strip of a tendon attached to the base of the thumb, wrapped around another tendon. This is a really poor drawing. Sorry, I'm trying to get rid of that. Again, outpatient procedure, same day. We usually do it with a nerve block where your whole arm is numb for about 18 to 24 hours. The surgery takes about an hour to an hour and a half. You're at the facility for about 2.5 to 3 hours. This is what we typically do. Again, I remove the bone. I take a strip of this tendon. I wrap it around another tendon. This surgery is sort of in the gold standards for decades. Like I said in the beginning, you get most of your thumb motion from this joint. So this procedure preserves pretty much all of your thumb motion. It gets rid of your pain and gives you improved grip strength compared with your preoperative condition. Finger arthritis. There's two options for the fingers. When you get into the fingers, the joints the joints and the bones get really small. For the end joint, the last joint just below your fingernail, we only really have one option, and that's fusion. What we do is we go in, we scrape away the rest of the arthritic bone. You can use pins, or I use a screw fixation to compress the two bones together until they fuse into one bone. You're basically turning a painful joint with motion into a fused, painless bone without motion. You lose your motion, long-term or permanent pain relief. You lose little function with these end joints. It does take a little bit of retraining, but you lose minimal function. Here's a picture of the next joint down. You can fuse that joint as well. Again, it provides long-term pain relief, although the loss of motion at the next joint down the finger is a little bit more significant with regards to function of that finger. So with that joint, we have another option. It's a joint replacement. Now, these bones aren't big enough to put big metal and plastic implants like the knee and hip replacement surgeons do. We have a couple options. Basically, we cut out the arthritic joint. We replace it. This is a picture, although a poor one, of a silicone or rubber joint. Basically, it has two stems that go into the bone that hold it in place, and then the rubber bends. It maintains some motion, although usually you don't get full motion because you didn't start with full motion. It's a good pain relief. It's less stability, so it's not ideal for every finger. For example, the index finger that you pinch your thumb against, it's not an ideal candidate. Here is an X-ray picture of a joint, two joints that have had their the silicone or rubber. It doesn't really show up great on X-ray. Here you can kind of see a little shadow of a rubber joint in between the two bones, and this simply bends when you bend your finger. So to summarize, the goal of treatment of all arthritis, especially in the hand and fingers, is to minimize the pain and stiffness, but maintain function. There are options other than injections and surgery. Our offices are open. We have strict social distancing guidelines. We try to limit the number of patients in our waiting rooms. We offer virtual waiting rooms where you can wait in your car until we bring you back. to our waiting, to the treatment room. We do ask patients wear masks. All the providers and our staff wear masks. We clean and sterilize the room in between every patient. So we have these strict protocols to maximize patient and office staff safety. If surgery is required, again, all safety and screening precautions are taken. We have started elective surgery. It is going very well. We feel that the precautions we are taking are working very well and are very safe. So if you have any questions, please let me know, but that's all I have.
Thank you, Dr. George. We did have a question come in from Mike. It says, Dr. George, thank you for a very informative presentation. What are your thoughts on arthritic-friendly diets with increasing antioxidants and avoiding carbs and acidic foods to help control symptoms?
That is an excellent question. Although I don't know of, although honestly I haven't researched it too much. It is a lot of talk about anti-inflammatory diets. I do think it is worthwhile. I think it's very difficult to get a patient to change their diet when they come in with a little bit of pain and stiffness in their fingers. But if you Google or research anti-inflammatory diets, there is a myriad of information, from the type of oils you cook with to the type of sweeteners you use and other preservatives. If I had to be honest, I think it does show a lot of promise. With that being said, I do not keep to a strict anti-inflammatory diet myself because it is somewhat difficult. It takes a major life and kitchen overhaul, but that's an excellent question.
Thank you. Was there anybody else that had any questions that if they wanted to use the chat box, or if we have one person talking at a time, you can go ahead and unmute yourself and ask your question. I'll give it a minute or so, just in case somebody's typing. All right, well, if there's no other questions, Dr. George, thank you again for your time this evening. The information was great as always. And again, to everybody who joined us, this session has been recorded and will be on the website by the end of the week or early next week. Thank you again.
All right, thank you. Have a nice night.
You too.